Simple. This is just basically how you start. So something totally random. First of all, thank you, Dr. Lindsay Spears,
You're welcome.
for being on the Appetite for Discussion show. Something totally random, has nothing to do with what we're talking about because I don't know what we're going to talk about. But in the women's restroom, have you noticed that they have hand lotion beside the hand soap?
Here or
Just
everywhere?
in general.
Yeah, a lot of places do.
Okay, so why? Because why do you need hand lotion in the restroom?
Because after we dry our hands, they're extremely dry.
Are
From
y'all?
the amount of times that we wash our hands every day, unlike men, and we need to moisturize after we do that.
Okay, but do you know how many times that I went to the restroom to wash my hands? I go, and it's the damn lotion. It's not.
So
the
it's in the
soap.
men's restroom too?
Yes, which is even more weird. I think that's why
I
I'm
don't think
asking.
a lot of men would use it, but yes, you could definitely
But why is there
mistake it for hand soap.
It's and it gets me
Just confuses
majority
you.
of the time because I don't have hand lotion in my bathroom at home,
You probably have body lotion that you would
somewhere.
use for the same.
but I don't.
Mm.
I'm pretty moist.
Okay.
Yeah, I don't have to.
Not ashy.
Not
Okay.
scaly. No, not so much. But yeah, I just think it's weird. I can't wrap my head around it.
I think it's a luxury.
Could be.
I think it's something that they try to be fancy.
You know what
about.
eggs look luxurious? Soft toilet paper. That is luxury. Ask my wife. She gets mad when I buy the cheap stuff.
Oh, I thought you were going to come at me for what's at my house, and y'all always make fun of me.
I haven't had the opportunity to
the
use toilet
scalloped.
paper at your house.
Somebody says something about it every single time.
Do you have the cheap Scotch stuff?
No, it's Charmin, but it's from Costco. So I mean, like, it's not fancy or anything. But everybody like, why is your toilet paper scalloped and it's so soft? And it's like it's called Charmin.
Oh, wait a minute, Charmin. Is that the one that has like the aloe with the lotion in it?
I
Speaking
don't
of lotion,
think it does, but it's like I don't know. It's printed and then it's got scalloped edges.
I'll be damned.
It's fancy.
You dentists, y'all have all the fancy stuff.
Yeah.
So, how long have you been practicing dentistry?
I have been a dentist for 11 years. Before that, I was a dental hygienist for 4
Really?
years. For real.
Is that what led you down the road to be a dentist, or did you already kind of know?
No, I knew I wanted to be a dentist when I was really, really little. And when I got to Carolina, I was really intimidated by the competition factor to get into dental school. So I was like, if I don't get in,
Is it hard to get in dental school?
extremely hard to get into dental school.
I've heard that. Actually, I've heard it's harder to get into dental school than it is med school. Is that right?
Yes, and especially at Carolina. And at the time, it was the only dental school in our state. Now we've got 3, but
What are the other 2?
ECU and High Point University.
Really?
I think it's High Point.
You dentists that go to ECU, I feel like that might be partying a little too hard.
Well, they're a lot younger than I am, so I don't know. It opened when I was probably a sophomore or junior in dental school. So, yeah.
Okay. So you got into dental school. So,
Well, I majored in dental hygiene and chemistry in undergrad so that if I didn't get into dental school, I would at least be in a dental office setting until I tried again. But thankfully, I got right in. So I worked as a dental hygienist while I was in dental school.
So what was it about you being a little kid sitting in that chair like, this is what I want to do?
I think and I wrote about it in my college essay. So the dental hygienist that like one of my earliest memories of going to the dentist. I'm sure I went before, but I was probably like 4 or 5, and it was her first day on the job. Like she had just graduated from her program, and so she was super excited to be there. And then, I come in and she let me play with everything. Like nothing was like off limits or scary. And I, left there, just thought it was really cool and was like, I want to be a dentist because I didn't know the difference between a dental hygienist and a dentist. So from then until like high school was I want to be a dentist. I want to be a dentist. And then once I realized there's a difference, I was like, I don't know, maybe I want to be a dental hygienist. So during high school, I did an internship at that office under the same dentist and was like, yeah, I'm pretty sure it's dentistry I want to do. So once I got to Carolina, I was like, I think I'm going to have to do a stepping stone to get in. But I'm glad I did it because I feel like it made dental school a little bit easier.
So when you say stepping stone, what does that mean?
Like, starting with assisting and then doing hygiene and then
Okay.
doing dentistry, because you're just building like a foundation of knowledge.
Mm-hmm.
And I feel like getting that 4 years of undergrad, but 2 years of that was a dental hygiene at Carolina. And, learned everything about the dental setting, teeth, and essentially the basics, and got my dental hygiene license. Well, then starting dental school back at square one, I had that already. So,
Man,
feel
what
like
a hands-on experience you had. That
Yeah.
had to put you light years ahead of the folks who are just like wicked smart and got into dental school.
I don't know if it was light years, but it definitely helped, where everybody had the nervous jitters of seeing patients for the first time. I'd already been seeing them for 3 years by the time I got to see patients as a dentist. And then, instead of taking the perio courses, I TA'd for those for my class because I'd already taken them and passed my boards for that subject. So it kind of broke it up a little bit to make it not so heavy.
Dang. Sitting here, I'm sitting there thinking, damn, you're a whole lot smarter than I realized.
I don't know about
Well,
that. Street smarts.
Street smart you have or no?
I do have street smarts.
So
I
you
think I
have this
street smarts.
weird combination that most people don't have: street smarts and book smarts.
I don't know that I have that much book smarts.
Okay.
I think it's more like things make sense to me.
So you're a big picture, put things together.
Yeah,
Okay.
big time, big picture, and future thinker. I don't know, more realistic. Like, what's the end goal here
Okay.
versus all the little details.
I'm still trying to see the picture. Just trying to find it.
I still don't have it either.
So you've been practicing for 11 years
As a dentist,
as a dentist,
Mhm.
and but you have parlayed that into doing some other interesting things.
Mhm.
Am I going to say this right? You are a coroner?
Wrong.
Wrong.
So
That's Kevin's fault.
Well, I worked as a dentist in public health for 2 years, and then I purchased my practice.
Okay.
And so I've been there for 9 years as
So when
a
you say
general dentist.
in public health, that was like at the...
I was a dentist in a public health dental office.
Okay.
So, yeah. I mean, it was in North Wilkesboro. So
Okay.
it was, a lot of population that can't afford a private practice dental setting. It's a lot of state funding and things like that. So, kind of got my feet wet doing that as far as like getting my speed up. Instead of taking 3 hours to do a filling, I got quicker and quicker, and helped me just kind of build a base for my own practice. And then, but you're thinking medical examiner. So
Yes.
North Carolina is a medical examiner system. So
Okay.
we don't have coroners.
Oh, really?
Correct. Yes. Coroners are elected officials in some states.
Well,
Whereas medical
seems
examiners.
very political.
Oh, it's very political. You have a campaign and everything.
To be able to pronounce somebody dead.
And you don't have to have a medical background. It can be like
What?
anybody.
You can be an accountant and...
You can be just a public official. I mean, it's an election. Yeah, just like anybody else. So, but in North Carolina, there are a little bit heavier requirements because we are a medical examiner system. So you have to have a
Okay.
medical background of some sort. But last August, legislation passed to allow dentists to become medical examiners.
Wow. And so I want to go back here in a moment. Remind me of your public service that you did for 2 years.
Mhm.
But what led you down the road of, hey, I think this might be interesting?
I spent a lot of time growing up sitting next to my mom watching like CSI, NCIS,
I
Law and
knew it.
Order.
Yep.
And I just find like the whole mystery, true crime, like problem solving fun. I mean, it's something I enjoy. And so when I went into dentistry, I didn't really think it applied to anything like that. It was just,
Right.
I like reading crime books. But during dental school, we had like a 1-hour lecture on forensic dentistry
Okay.
and essentially how being a dentist can apply to death or law or crime scene. And I just thought it was super fascinating. But the advertisement for that one lunch hour was like this $4,000 1-week course at UT. And being a broke college student, I was like, I'm just going to have to like shelve this for a little while. And so when I graduated, I took that same pamphlet to my job in Wilkesboro, kept it in my drawer. And then when I bought my practice, I took it to that job, kept it in my drawer. And probably about, 24, I started really like hardcore in 19 probably. So I would say in like 2018, I guess I'd owned my practice about 3 or 4 years. I pulled it out and was like, I wonder if this still exists, because it was such a cool program. It was called All That Remains, and it was essentially a crash course in forensic dentistry. So learning about how to identify people by their dental x-rays, or looking at bite mark injuries and being able to tell, is it a bite mark, is it not, and is it good enough to be like brought up in court, and then they had like clandestine grave recovery, which was the big thing, and I was like, that'd be so cool, let's go dig up a body.
No, wait, what's it called again?
Clandestine
grave
recovery.
So
yeah.
you do that or can be
I
a part
have
of that?
done that.
Get out of here.
Yes. The program that I had a pamphlet for at the time was only offered every other year. And the year that I was like, I want to do this, it wasn't offered. And I was like, well, shoot. Well, it started like, I started digging and trying to figure out like literally how to get into this field, and discovered the American Board of Forensic Odontology, which is essentially the governing body for any dentist who plans to practice forensic dentistry, and it's the board that holds you accountable for the opinions that you have.
Oh, wow.
And so I started in 2019 trying to check off all of the boxes to sit for my boards, and that's what I'm working towards currently, is being a boarded forensic dentist. So I currently practice as a forensic dentist, but I am working towards my boards.
So walk us through how they, what they do when they exhume, pull up from, is that what they call it? Exhume a body?
Well, like that's already been buried.
Already been buried?
Yeah. Yeah. I mean,
so they just go and dig it up and then.
Well, like the clandestine grave recovery is more like it's forensic scientists who have placed bodies, like donated bodies in certain places, different depths of the ground, or in different like environments, like in the trunk of a car, and they watch them and see how they decompose over time. But the clandestine grave recovery is like, say they know that they've got this plot of land and there's a body there. It's literally going and digging for this body layer by layer by layer, and mapping how they are and how they're placed, and doing essentially an investigation on site. So wouldn't be my job to do that, but I had to be trained in it as part of the forensic dentistry goals that I have. So we had to dig up bodies, and we had to then bury bodies, so that a police group or some other kind of group that needed the training could come and do the same that we did. That was in Tennessee.
I feel like this should be documented somewhere, and there should be a YouTube channel.
There probably is somewhere.
There has to be.
Well, the body farm where we were.
It's called the body farm?
Well, that's the lay term. That was coined by, of course, I forgot her name. She is a really good author. And so Bill Bass is who started the body farm. He's a forensic anthropologist out of Tennessee, and he was huge in like the University of Tennessee Anthropology Center. So she wrote a book essentially kind of using him and his job and what they do there as inspiration for a book. And so she coined it, and it's called The Body Farm is one of her many books, but she's phenomenal. And so everybody knows it as The Body Farm, but its acronym is BARF.
It's getting better.
It gets so much better. Bass Anthropological something Forensics Center.
Got it.
So
BARF.
like BARF, yeah, or ARF. Some of them leave off the B, but so Body Farm just sounds so much nicer.
It does. It sounds like a book, and it is.
Yeah, it's super nasty. I mean, you go out there and like it just singes your nose hairs. It stinks so bad. But what's done there is it's just really cool. I mean, there's all kinds of like stuff to see, like bodies, in all stages of decomposition. They study entomology there, which is like the study of bugs, and like what bugs show up at each stage of death can help you determine how long they've been dead. And it's just super fascinating, and it's all science based. So when you like focus on the science of it, it takes away all of the drama and the nastiness and everything, and you're like, this is really cool material. But yeah, so they used to, when it was smaller, offer like tours.
Yeah.
And at the point at which a Girl Scout troop wanted to take a tour, Bill Bass decided that it was time to shut that part down. So they don't offer tours to the public anymore. You have to be like in forensics to be able to be a part of it and go out there. But yeah, there's some fascinating stuff.
So basically, you're like the Indiana Jones of dead people. That's what I'm hearing.
I've got a long way to go, but I guess that would be my goal.
Yes, you're the Indiana Jones of dead people. Wait till I tell Dimp and Sully.
Oh, yeah. They're going to love it. Yeah. No, I came home, from doing an ME exam at a morgue, and my daughter told me that my hair smelled like dead people, and I was like, the fact that you know what that smells like, I don't know if I should like pat myself on the back that I've got like a future scientist going on, or if I should be really ashamed of myself.
Or is she like the spirit of another person who has smelled dead people?
Yeah, like what's going on there?
What's going on?
I don't know.
But it
didn't, I mean, she still cuddled me, so it didn't bother her too much.
Very intuitive of her, though.
Yeah.
Because she's not old enough to really know
She's not, but she is science-minded, which is awesome.
That is awesome.
I think it's awesome.
Good job.
Thanks.
Does she?
Yeah.
So you're into crime novels, obviously. I'm sure crime podcasts, of course.
Always, yes.
Which is your what's your favorite? What's your go-to crime podcast?
I have a big issue with closure, so anything I start, I have to listen to like episode 1 all the way to the end. So I've listened to all of the Crime Junkie podcasts, which are awesome. Probably my favorite. I like the two girls that talk. They're funny, but they stick to the story and they're not too opinionated. It's very factual. And then Sword and Scale is sometimes a little much, just the detail they go in, but I've probably seen and heard worse. So they're really good. I've listened to almost all of those. Morbid is a good one. Okay. Yeah, sometimes they can go off on like tangents that don't apply to the story, which I'm like, fast forward, because I just want to hear the story.
Right,
but,
get to the good shit. Right.
Yeah, but dig
the body up.
Exactly.
Let's get to science in this thing.
Yeah. So yeah, I mean, there's a lot, and then I like historical ones too. There have been a lot of really like juicy stories from the past, like Crimes of the Centuries. That's a good one, and it's like crime stories that actually happened that nobody talked about because at the time it was like taboo to talk about dead people or crime. And so they like tell you about the bad things that happened in the 1920s and you just wouldn't know about it otherwise. So it's pretty cool.
Have you listened to the podcast about the murder in Mooresville? It's called Unforgotten. Mm-mm. It was very popular a few years ago. And I had the author or podcast host, Freddie Wilson, on the show to talk about it. So he was actually a nurse, went to Mitchell College, graduated, and was murdered in his home.
Oh, my goodness.
With his wife and child there, and they have not found who did it.
That's crazy.
It is crazy. You should absolutely. Yeah. Because you can drive down 21 and almost see the back of his house.
Oh, wow.
Yeah, you can drive by it. We've done two junk jobs in the neighborhood, and every time I drive by the house, and I'm like, there's the store they ran to. That was,
Yeah. Oh, I'll have to listen to that.
Yeah, you will. It's called,
some of them hit very close to home. Yeah.
Yes.
There's a lot that goes on in North Carolina.
Really? Like, what's the story like right now? Really? Like that sticks out to you?
I mean, there's a lot, but a lot of even the podcasts that I listen to, they're like, well, in rural North Carolina, and you're like, again, like really? Florida is where you should always be when you're hearing this crap. But yeah, lots happens in North Carolina. But yeah, so I mean, since I've become a medical examiner, I actually have a very different perspective on things as far as like, it's not the best system in the sense that I feel like we could do better. And there's probably a lot of like unsolved crime in North Carolina simply based on like what I have seen personally in, the 4 months that I've been appointed a medical examiner. So,
right.
it's eye opening.
So speaking of doing better courts and what you do, we had talked, was it last summer, about you were reading a book, and I just happened to be listening to a podcast that they'd mentioned this gentleman, but I think he was trying to debunk maybe about dental forensics, like bite marks and stuff, because there is some controversy around it. What's that guy's name?
Chris Fabricant.
It wouldn't matter. You could say Donald Duck, and I wouldn't remember. But yeah, and I thought, well, interesting. And what are your thoughts? I mean, obviously, you do think that there is legitimate science behind it.
Who all listens to this podcast?
About 7 people.
Oh, okay, good. The book is great.
Watch.
I have to give him credit. The book is great. Kind of like I don't appreciate the opinions of the podcasters. I just want to hear the meat of it.
Sure.
He's opinionated and very, he does not like forensic dentists at all. So back in the day, there were some, there were some dentists who felt that they were forging the path for forensic dentistry.
Okay.
And so they literally hung their hat on certain things, bite mark being one of them. And I think most of them openly admit that it was a mistake.
Okay.
But essentially they were wanting to say that bite mark is a science and it is founded in truth, and they can prove it without having the science yet. And so there needed to be more research, and there needed to be more metrics and things involved that you could sit down and say, all right, this image of a bite mark or this injury can be like I can factually tie this to adult teeth.
Yeah, sure.
But there was no way to do that at the time, and so a lot of research was needed and still is needed. There's been more, and there's certain ways. Like, I'm pretty confident in saying it is or isn't a bite mark. But as far as taking it to court, you cannot say, like, even the board, the governing body said you cannot say this person bit this person.
You can't be definitive.
You cannot. So back in the day, you could. They would say, without a doubt, this person bit them. And you weren't there.
Sure.
DNA wasn't swabbed. Like, you don't know for a fact that they did it. So now the terminology is I can or I cannot exclude this person from having made the bite. So when you've got, a case we did a few weeks ago is there is a child that's got a bite on his leg, and there's only 3 people that were there at the time. So you have a very closed population. Well, when you are comparing those 3 sets of teeth, one of them's crooked as all get out, but the bite mark is straight teeth. I can say that's not likely. Right. And be 100% in my opinion. I think Chris Fabricant's issue with a lot of patterned injuries, so like blood spatter and other things that you study the pattern as it has happened and try to guess what happened. He just doesn't think it's founded in science. And so he's very vocal about that in the book. And it was nice to read, to hear the opposing opinion, because I'm not 100% sold either. Like, sure. I think it does need more research.
Well, I mean, it's medicine. I mean, it's science. There's always scientific base. You have a hypothesis. You're always trying to, do your research and find, and we do find out some things are wrong or partially right or whatever, and we get better at it. Yeah. I will tell you, after watching The Staircase and Making a Murderer and all this other stuff, blood spatter, y'all full shit. Yeah. Yes.
Well, and he even...
and never do a murder in Durham, North Carolina. Right. Because you going to jail. Doesn't even matter if you were there. Right. Right. Just don't even get pulled over in Durham. Yeah. Don't. If you can take a back road and get through, because you go to jail.
Exactly. So, Chris Fabricant is an attorney in New York, and he represents the Innocence Project. Yes. And so his kind of MO, from what I understand, is to get wrongfully convicted prisoners out of prison. Well, if they're wrongfully convicted, I totally agree. Let's get these people out. Sure. But I think I think that these prisoners are smart enough to sway people into believing that they're innocent when they're actually not. And so there are some that actually need to be there and should have been put there no matter how they got there. Sure. I don't know. It's a very like sticky situation, I guess.
Absolutely. There's a lot of bad folks in the world that could probably stay in prison and never come out. There's probably some folks who are there that could come out, and maybe they have done their time and they have been rehabilitated, if that's even really words you can use. And then there's some folks that I'm sure it'd be interesting to know, like, because there's no way to know exactly, but like, what's the percentage of people who are falsely imprisoned?
Right.
You know?
Right. Well, and it depends on who you're talking to.
Well, true. Right.
You know, if you speak to the Innocence Project, you're going to hear a much larger number than what,
Correct.
you know,
An attorney or
prosecution
they're all
would
guilty.
say. Yeah, I mean,
Right.
they should be in there. So it's very, there's a lot of opinions. A lot of opinions.
Well, there's a lot of opinions, and too, now that we live in a technology world where we can watch documentaries, and whoever films the documentary might want to spin it in a certain direction.
Exactly.
Or if you're listening to a podcast and you're listening, you know, then you're almost like, well, if there is an unsolved murder and they only have a suspect, and it's like very loose or no evidence, the community want the case closed.
Right.
So
there's a lot of pressure there.
Pressure to make people feel better.
Yeah.
You know, like, yeah, we got them. You know, they write books and movies and all sorts of stuff about that.
Yeah. Basically,
just don't leave your home.
It would be safest not to. Yeah, it would be safest not to. Yeah.
So, that's interesting. And I believe a couple of the guys from the Innocence Project, I don't know if it's the gentleman you were mentioning, but they have been on Joe Rogan a few times. And there's only a few episodes of when he has a guest on when I am arguing back to my phone when I'm listening. Now, and I have, but sometimes I'm like, are you listening to your own, listen to what you just said?
Yeah.
You know,
well,
so
and I think it's also misconstrued that a lot of people, the way that bite mark has been portrayed is that, like, somebody said this bite mark was caused by this individual, and that individual went to jail because that bite mark, like somebody said that. That's not the only piece of evidence. Like, it is a tiny piece in a giant puzzle. So I feel like it's something that they've clung to because they feel like it's an easy thing to disprove because there's such a lack of research there.
Yeah, sure.
And so that's one thread they try to pull to get people out. But there have been prisoners who have been released and reoffended within 24 hours and put back in on new charges. And it's one of those things where you're like, do you really think you should have pulled that case apart?
Well, yeah.
Yeah.
So didn't they catch a serial killer, a famous serial killer, because of a bite mark? Was it the Night Stalker?
No, it was Ted Bundy.
Ted Bundy, that's right.
So, and again, I mean, the bite mark was a big deal.
But it wasn't
the thing that put him in prison. So, yeah, he's pretty famous for that bite mark.
He is pretty famous. Why do I think Night Stalker? I think he bit his people too, though. He was a weirdo.
A lot of people do. I mean, there's like a...
Why?
I think, like, if you don't have a weapon, that's just one of your strongest...
I mean, I get it, I guess. But if I was playing defense, I'd be biting the hell out of you.
Yeah.
But not if I'm on the attack.
Well, and that's my thought. I mean, there's a famous case where a mom was killed by her two teenage twin daughters. And... she had bite marks all over her. The two daughters had bite marks on their arms, and so they were claiming self-defense. Well, they were claiming, self-defense, and I think it turned out, I can't remember the details exactly, but the mom was biting in self-defense for sure, but the daughters also felt like they needed to bite themselves to prove that. And so the areas that they had been bit could easily have been replicated by themselves. So, I mean, it's just one of those things where you can't always say, oh, they were biting because they were defending themselves. Some bites are self-defense and some bites are perpetrators.
So when you're, have you ever had to identify a body from their dental work before?
That is bread and butter forensic dentistry. So essentially that is the majority of what I do. So there will be unidentified remains, or they have an idea of who it is, and the autopsy technicians or a forensic dentist at the scene will go in and take the x-rays just like you would if you were sitting in a dental office, and take all of their dental x-rays and send that to me. And then if they have an idea of who it is, or if they're wanting to know, is it this person, they'll send me that person's x-rays or dental records. You may not have x-rays from when they were at the dentist at some time in their life. And so there are multiple techniques that I can use to compare and see if one is the same. And then I usually have to write a report that gets submitted to the chief medical examiner. And it's usually, ideally there is always 2 positive forms of ID, and dental is one of them. It's usually DNA, fingerprint, and dental are the most trusted.
So what is it about the tooth or the jaw or whatever it is you can see, I guess the teeth, that allows it, that keeps it from just completely deteriorating?
That's a good question. I mean, the reason that teeth are such a good comparison is because of there is a distinct number of combinations of features that you can have in your mouth. So, much like fingerprints, not every single person in the entire world has been fingerprinted. So they cannot say that this is the one and only person that has this fingerprint. It's just so unlikely that anybody else would, because they're unique, to lack of a better term. And kind of teeth are very, very, very similar in that fact that not only are our teeth very unique to us, but the bone around the teeth, they have different patterns and trabeculae where the sinus hits the roots of the maxillary teeth, or there's just all kinds of different features that are going to be unique to each individual person. And then you throw in on top of that tons of restorations. You can have so many. You can have missing teeth. You can have teeth with large restorations, teeth with crowns, root canal teeth, implants. There's all different things, and like that distinct combination is so numerous that if you find the match, or they do look alike, then you're going to say it's one in like 4 billion something, and it's just hard to beat that odds with anything else. But as far as
unless you're OJ,
right? You gotta have money for that. But like as far as the teeth surviving, teeth are very well preserved, and I think that's kind of like bone. Bone's going to survive for a very long time. It's a similar material, but it also has your mouth and your jaws and your cheeks are all surrounding it. So if anything happens to you, it's unlikely that something happened in your mouth. Even plane crashes, they're going to look for bits and pieces of teeth.
Damn.
Yeah.
Even in the plane crash.
Oh, yeah.
Have you had any dealings with the plane crash?
Mm-hmm.
Get out of here.
Mm-hmm.
Do tell. So just like a massive plane crash, like private plane crash?
So the ones that I have been involved in were private plane crashes. Obviously 9/11 was the biggest, most famous. I have a patient actually who finds what I do super fascinating, because her brother was a firefighter, and he died in, I believe, the second tower, where they had kind of made headquarters. When the first tower got hit, they put in the second one, and they identified him by his teeth. And she just thinks, she's like, that's super cool that you do that. Like, I would have never known. And I think she found out like a week later. But a lot of the forensic dentists who worked 9/11, they were a primary source, because when you've got mass casualties like that, you're not going to have a whole lot of fingerprinting, especially in explosions, plane crashes, and stuff like that. It's going to be hard to find an intact finger. DNA is only useful if you have something to compare it to. So you would have to have a sibling or a mom or dad somewhere down the line that's willing to bring you their DNA, and so they still do a lot of that. But teeth can also be like harvested for DNA later. Like long bones and teeth are pretty good sources of DNA. So they just end up being like a really good thing to have. But yeah, so lots of private planes we call doctor killers, because it's usually a doctor on board who's going down. But yeah, and Kobe. So you think, when they find teeth, it's a closed population. There's only 2, 3, 4 people, it can be. You know, if the flight record is accurate, and it's pretty easy to narrow them down by age and who they are based on their teeth.
So, is it possible that his remains were identified by his teeth?
It's highly likely.
Well, not just him, but all the
Yeah,
passengers.
it's highly likely that he was identified by his teeth. I mean, they knew he was on there, so
Right.
then they would have his dental records readily available. So, like, the quickest, cheapest way to do it would be to pop those X-rays up there and be like, "Yep, that's him."
Oh God.
Yeah.
That puts a whole new twist on the story.
Yeah.
Damn. You don't think about that though. You know,
Yeah.
identifying survivors in like a mass casualty by their teeth. Or sorry, I don't think about that.
Yeah. The only mass disaster that I know of off the top of my head that didn't utilize forensic dentistry as much, and it was mainly because of what happened, was the fires in Hawaii. So, I mean, if all your dental offices are burned down, you don't have the records to compare them to. So,
Damn.
Interpol was sent to do fingerprints because a lot of people died of smoke inhalation. So they do have fingerprinting readily available. So it was a lot quicker. But as far as like inexpensive, I mean, forensic dentists, to be honest, work for free because we just want to do it. I mean, we just
Right.
want to like be a part of it or, figure out the puzzle.
So let's say that this is going to tie into what I was going to come back to earlier. But how difficult is it if someone has their teeth and they're going to the dentist, but then their life takes a twist and they start having meth mouth, and then they don't come to the dentist, so you don't have any images of their new current teeth situation. Are you still able to? Really?
Yeah. IDs have been done off of one single tooth before. I mean, like it's that specific. So I mean, very similar to fingerprinting. I mean, it may not be as specific, but it is very close. So, like I've done IDs off of, this kid went to the dentist until they were like 12, and then parents quit scheduling it for whatever reason, or the kid got on a bad path and remains are found in his 20s. Well, some of the teeth aren't even there because they were baby teeth, and there's still features like you can look in the x-rays and see, all right, his first permanent molar or second permanent molar wasn't even in yet, but I can see that whole tooth on the x-ray. Well, that tooth, by the time he's 25, is well in. And if we've got that picture, I mean, you can compare those teeth. And he didn't even have it when he was 12, like in the mouth, but it was in the jaw. So personally, to me, I think it's pretty easy. You can look at it and say, that tooth is identical. Like, they look just alike. And then a lot of the times, unfortunately, because some people don't go to the dentist or never have had dental x-rays, we do medical x-rays. So like CT scans, implants, like spinal fusions. And if I've got like a CBCT from somebody's like lateral side and they've got like...
I'm sorry, what'd you rattle off?
I'm sorry.
For those of you at home who don't know what she's saying.
So sorry. CT. So like if you're having like neck issues or whatever and you go and you have your vertebrae fused together, they put an appliance in there.
Right.
Well, in the same view of that x-ray, whether you're alive or dead, that's going to look exactly the same. That metal's not going to change. Sometimes it even has a serial number on it. Damn. So, I mean, we can look at that and say, yeah, it's highly unlikely that two individuals within a certain radius has this exact same implant or fusion. So, it's not always just teeth, but teeth are super, super specific.
So, even the folks who go out there and get meth mouth still can be identified. It also is weird to me that like you see people's teeth, like the kids, but like they have teeth in their jaw that are there, and you can see them on x-ray. I don't know why, but that just seems so like, why is there not pressure? Why am I not in pain? Like, why? That's just so weird.
The body is really cool. I mean, that's just where all the science nerd comes out, and you're like, I mean, it's crazy what your body does and what it can do. I mean, it's amazing. But like when you're born and you have no teeth, like if you look in your mouth and there are no teeth in there, you have 20 teeth in the bone at that time. Like if you could...
No way.
Oh, 100
like,
way,
up
yeah.
in the gums, the baby's got teeth up there?
Yes. And and from the time that you see a tooth come in, so let's say like, Sully's front tooth drops in, just a sliver of it.
Yep.
From the time that exposes, you've got 2 years until that root's formed. So it may just be the crown at that point, but as it grows in, the root is forming, and it's about 2 years later that it's completely formed. So you also got to think that like when those baby teeth are in there, I like taking x-rays of my kids because I can always show them like there are millions of teeth they've got in there. But like, Eli's got 2 baby teeth hanging out in the front. Well, above that, he's got 2 full-grown adult teeth hanging out up there under his nose.
Little Eli
has
got these massive
honking teeth. I mean, honking.
That is crazy.
And they're already, they're there. They're just cooking, and it's just really cool. But those teeth wanting to come in are what stimulates those baby teeth to dwindle away and come out. So, it's really neat. I mean, especially over time to see the differences in the teeth. But that's where age assessment comes in, which is another feature of forensic dentistry. And so that's where we look at x-rays, or there's a ton of different studies out there, and in being able to look at a tooth and tell how old the person is. Super easy when they're kids because they're at all different stages of development. You're like, oh, that one's developing, but that one's complete. Well, they've got to be between this age and this age. But once they're all adult teeth, there's a lot of different ways too. But the benefit of that is, what I've seen is you see somebody from another country come here and they commit a crime. Well, a lot of people from other countries develop at different rates than we do because there's a different nutrition.
Right.
They may not have access to food or something, and it slows down your development. Well, they can be 25 years old and they're like, I'm 16. They don't have a birth certificate. There's no way to say, this is how old this person is, and they commit a crime, and you're like, do we charge them as an adult and if they are 16, throw a kid in an adult prison? Or do we say they're a child and you're putting an adult criminal in with a child population? So it's like not good either way. So we'll look at x-rays and narrow down how old that person was when they committed the crime and give the court something to kind of go off of to make a better decision in what they're going to do with this person.
You know who should be implementing that dental x-ray policy is the Little League World Series. Do you remember years ago when that Danny Alma whatever, and they were like, oh, he's 12, but really he was 16 and throwing just gas. And everybody was like, how is this happening?
It would be helpful. I mean, it's a screening tool.
That's all it is.
I mean, does his birth certificate not
say?
I
mean, he has to have a physical. You got to wait, take your blood pressure. Let's take a picture of your teeth.
Take some dental x-rays. Yeah. I mean, it's never a bad idea to take dental x-rays. I mean, there was a guy who was identified. He committed suicide, but he was identified by his teeth, but it was through a picture that he had taken recently. Like they had family portraits done. He was smiling real big. Well, remains are found or a body is found, and they have no idea who it is. They think it's this guy, but they check. He's got 3 different dentists because he had like multiple houses in different places. And every time he would go to the dentist, he'd be like, oh, my dentist, at home took these last time, so I'm not due. Wouldn't get them. Then he'd go to the next dentist. He was at his other house and would go to the dentist and say, oh, yeah, my last dentist took x-rays. I don't need them. So he never had any x-rays taken. I'm like, really? You've got 3 houses, but you can't afford your x-rays. Whatever. So he's found, they find teeth, and they, through like using Photoshop and things, they superimpose those teeth over this image. And because of some like unique things about how his teeth are laid out, they're not perfectly straight, the shape of them and stuff, they were able to do an ID, but it had nothing to do with x-rays. It was all based on photography. So, there's just lots of unique features about teeth.
Speaking of x-rays, what are your thoughts on the patients who are like, nope, I'm only going to get an x-ray every other year or every 5th year because of the radiation exposure, and I'm going to get a brain tumor?
Well, I have multiple opinions on that. Let me get into my dentist.
Are you saying that you've actually had that scenario before?
Multiple.
Yeah.
So there's multiple issues there. So I am a huge proponent of patient autonomy. And if you don't know what that is, it's the patient's ability to make decisions for their body. So I can only give you the education that I have in my tiny little brain and tell you what I think should happen or what I would do if it were me. It is up to them at that point to make the decision what they feel is best for their body or their life or their finances. It's not up to me. So while I would love to see x-rays once a year at least between the teeth, mainly because my naked eye cannot see between your teeth, much like you can't clean between your teeth.
100%.
And I want to be able to see that so I can confidently say you do or do not have something going on. Like, I can't make a good diagnosis if I don't have the data to support it. So the North Carolina radiation group, who allows me to have radiation in my office, they have limits. And if I don't abide by their limits, then I can't work.
Okay.
So it kind of trickles down. Well, they require at least once every 2 years. Well, it takes a cavity about 6 months from the start that it's a little bitty tiny bacteria to the time that I can barely see it on an x-ray. So it's a quick process. I mean, if you've had 4 6-month intervals between your last x-ray and the one that North Carolina radiation wants you to have, you've got a big old cavity, like a big bomb, and you may be looking at a root canal. I think that's too long. So some people are like, no, what is the bare minimum I can do? I'm like, 2 years. It's up to you. But this is the risk you're taking. Now, those are usually the people who are just trying to avoid the extra expense. And
Okay.
I get it. So they're watching the pocket. It's not about radiation. The ones who have issues with radiation, they don't want x-rays ever. Some of those, I'm like, I get it. You had radiation for a year for X, Y, and Z. You don't want it anymore.
Sure.
I get it. They have to understand the risk that I may not be able to tell you what's going on because I can't see it without an x-ray. I do not have x-ray vision. I cannot tell you what's going on without the appropriate data. But then there are those few who are like, radiation's going to kill me. This is not good. I have to remind them that a pan, so the thing in my office that would expose the most radiation to somebody would be a panoramic, which is the one you stand in and it goes around your head and it shows all your teeth in one image. Taking that one image has been compared to like being in the sun for about a half a day. So like go out to the pool with your sunblock on and hang out by the pool with your friends for a half a day. That's essentially the amount of radiation that you got by taking a pan. Now, what we want them to do usually is about 4 x-rays that are like yay big, which is extremely a lesser amount of radiation than the pan. So, I mean, you're looking at like maybe driving from here to Walmart and back would be the amount of radiation. And you do that every day without thinking of it.
Right.
I mean, are you going to sit in your house
I put
and
this right here to my ear every day.
not use your microwave
Right.
and not use your cell phone to avoid radiation? No, you're not going to do that. But this is what they choose to focus on. But with back in the day, I was trained on film, and that required a lot more radiation than what we have now. I mean, now we have digital sensors, which you snap the x-rays less than a second, it pops up on the computer. I mean, it's just, they've been able to fine-tune it to be nothing. I mean, North Carolina doesn't even require you to wear lead aprons anymore.
Really?
There is literally no harm unless you are in radiation for cancer because you're wanting the radiation to hurt bad cells. Right. That's not what dental x-rays are. It's a picture. And it's as close to a photo that we can get because there's so little radiation. Yeah. So, we still have people that want the lead aprons, and we're like, the lead that you're holding on your body is more dangerous than the radiation that you're getting from this one x-ray.
That's interesting.
Hello. Yeah. So, but it's a matter of education. People don't know that. They grew up hearing what mom or grandma said about how horrible the radiation is, and everything that was coming out about radiation being bad. Well, that's the whole reason that the science has developed to make it less and less needed. So,
I wouldn't. Obviously, I'm not smart enough to be a dentist. But
you
if
don't know that.
I'm
there's some really dumb dentists.
Well, there's some really dumb doctors. Period. I've met some. I wouldn't let them check my mail. Like, I'm serious.
Right.
But I would think, because I would feel, and I don't know if you do, this sense of pressure. Like, as a dentist, I'd have to have perfectly straight white teeth.
Oh yeah.
Because do you feel a pressure like that?
No, not really. I think we should feel that more.
Your teeth are straight though.
They are straight, and
Yeah.
I've done ortho 3 times, so apparently I do feel a little bit. But it's one of those things, like, I mean, I had a checkup X-ray, like, literally within the last 6 months, and I was like, "What the heck is that?" And I had an abscess.
Did you know that you were having
I
an
had
ab-
no idea I had an abscess.
No kidding. So you can have an abscess tooth. I guess it's festering,
Yeah,
and you don't even have the symptoms
I
of
had
it.
no symptoms. Very strange, and yeah, it's just one of those things where, like, I mean, yeah, I then had to go get a root canal, and you would think, oh, you're not taking care of your teeth because you have to get a root canal. I literally am a banshee. I floss I can't go to sleep unless I've flossed my teeth. I wear my night guard. I wear my retainer. Like, I'm OCD about my teeth. But it's stuff like that where you're like, oh my gosh, like, she's had root canals. You must not take care. It's really, there's a huge genetic component.
Mhm.
There's a huge, like, pH in your saliva component. Your diet. I was a soda fiend for a long time, and I feel like that gave me a lot of cavities. But, it's all about education. You learn what
Right.
you're doing wrong, and you do better.
So it really is bad to put Mountain Dew in the baby's bottle.
Please don't do that.
Please don't do that.
Yeah.
And that's a real thing, though.
It
like
is a real
they
thing,
call it-
especially in this area.
Really?
Yeah.
I mean, yeah. Well, that's true.
But I mean, the even sadder part is the people who are putting Mountain Dew in their baby's bottle are not coming to the dentist
Mhm.
either. So it's worse than we even know. Yeah.
So I want to go back for a second to flossing. How important is flossing? Like, is it more important to brush the teeth or floss?
Okay. I heard a quote one time that was, I mean, they always say you only floss the teeth you want to keep. Blah, blah, blah. Have you heard that? Okay. That's a big one.
No, I haven't heard
That's a big
that
one. The best one that I've ever heard was not flossing your teeth is like taking a shower and not washing your butt crack and your armpits. Because it's a
Makes
tiny
sense.
percentage of your exposed skin, your body, but it is very important parts. And when you think about teeth, your tongue and your cheeks, God made us to where our tongue and cheeks can literally naturally deflect debris. In dental school we had to like hand wax teeth and like work up denture settings and stuff where we had to hand wax gums. And so, like, in my mind, teeth are like this big and I can see every detail of them. But every detail of them, God made this natural protective defense system in your mouth, which is crazy. So you've got spit that cleans your teeth all day. All day. We are licking and swallowing and getting the crap off our teeth.
Right.
And then the way that our gums come up between our teeth. So if you think about teeth, they're shaped kind of oval, kind of triangular. Anyway, there is like a triangle between each tooth. Well, that is filled with gum tissue.
Mm-hmm.
To keep stuff from getting in that hole. So it's just natural. And all of those areas are exposed to your cheeks that you're using when you chew and when you talk and when everything. I mean, if you're just sitting there, you're usually moving your tongue. There's 200 muscles in your tongue. It moves all the time.
200 muscles in the tongue? Damn.
So you've got some natural defenses there if you don't brush your teeth at all. The only part in your mouth that you cannot get to is between the teeth.
Mm-hmm.
Floss. I mean, it's not difficult.
Right.
It's not rocket science. But it's so helpful because, I mean, you've got these people that come in, they're like, I don't understand why I have a cavity every single time I come. And I'm like, are you flossing? They're like,
About that.
no. And I'm like, yeah, you're only cleaning the parts of your teeth that are smooth. You're not even getting where there's tight nooks and crannies.
I have a buddy. I don't know if he's changed, but we were well into adults, like married with children adults.
Mhm.
And he flosses when he goes to the dentist. That's when he gets the flossing.
Mhm. Yeah,
Like-
and we have people who say that. Like, why would I floss? You do it twice a year. And you're like,
You wash your ass twice a year?
exactly. I mean, you'll never forget that quote. It's just
Nope.
one of those. And it's funny because my ENT actually has that same quote for not using like a xylitol saline spray in your nose.
What?
hmm He used the exact same quote. He was like, it's kind of like showering and not cleaning your booty and your armpits. And he was like, it's the natural detergent for your respiratory. And I'm like,
What, do I need to be doing that now?
Apparently, we're supposed to be using a xylitol, which is like a natural detergent that's safe in the body.
Is it kind of like a
Saline.
betadine that you can? Because I've seen like during
Well,
COVID, some
betadine is like a
doctors saying,
cleaner, right?
Yeah, you could just.
Yeah, but xylitol is I guess a natural. I mean, xylitol is what they put in like ADA approved chewing gum because it's sweet, but it's not harmful.
I could be wrong. No one quote me on this, but I think even Dr. Peter McCullough was talking about how you could use a certain solution, mix it up at home to spray in your nose before, maybe after you've been in public or something like that.
Yeah,
to help
I mean,
protect yourself.
anything to like get the gunk
All
out of your
right,
nose.
so now, what about the little picks that you buy for?
They're good and bad. I mean, if you're
Okay.
not flossing, it's better than nothing.
Okay.
The downside is a lot of people don't know their own strength. If you're sitting there abrading your gum tissue with a pick, it's gonna go away. Like it's skin, it's soft, so it's gonna go away, and then you're left with that gaping triangle that God naturally covered for us.
Right. Oh God.
Yeah.
So with all of your experience with all the fun, dead, decomposing dental stuff, do you think you would ever write a book, fiction or nonfiction, about it?
I hadn't really thought about it. I don't have a lot of time.
Well, it's not now. I mean, it's
I don't
later.
foresee ever having a lot of time. I think I function best when I am like super overwhelmed and stressed out.
That's why you write a book.
Well, wouldn't that be an ideal time?
I think so.
I don't know. Yeah, hadn't thought about it.
Okay, before we wrap this up, a couple questions for you. If you were literally stranded on an island, or you had to leave your house immediately and you could only grab one of the two things, would you grab your toothbrush or your dental floss?
Probably my dental floss. Because it is more useful than just teeth.
Oh, very okay. Oh, some survival
And I
skill.
could fish with
There
it,
you go.
you know.
Are you a survivalist?
I should be, but I'm not. No.
Yeah.
I do have a go bag.
You have a go bag?
It's not really a go bag. It's like all the expired crap in my office.
Mm-hmm.
If an EMP hits,
Yeah.
I'm going to get it.
Okay.
Because it might keep us alive. I can either sell the stuff.
Should it be at
or
your
use the
house?
stuff.
Because you can't drive your car to get there.
I could walk. It's not that far. I could walk.
It's not terribly far.
It's not far. I keep it there because multiple people contribute to it.
Okay, all right. So it's a community go bag.
It
Okay,
is.
that's good. That's good to know. Get
Yeah.
there first because they're going to
Well,
take it.
you know, I'm not going to use something expired on my patients. So,
Right. Just so we're
but
clear.
it very clear. I don't use crap on my patients. I'm bougie like that, I guess. But
Well,
some
I
people
would
do. Some people
oh,
do.
trust me, I've seen.
Yeah, some people do. I
I've
do
been in
not.
hospitals all over the world, and
But I've
see.
spent so much money on the. I mean, supplies are
Mhm.
expensive, especially right now. That I'm like, I cannot stomach throwing that away. Let's just put it in our go bag.
Yep, put it in the go bag.
Yeah.
Huh.
I
If-
plan to be like Paul Revere if an EMP hits. Like, I'll make it.
I think we talked about this. You've read the books 1 Second After,
Uh-huh.
1 year later, and
Mhm,
whatever it
mhm.
was.
Yeah.
I'm still in the 1 second after. So okay, interesting.
Mhm.
Yes, you are a bit
Mhm.
of a. I don't want to say a prepper, but
Yeah.
you get.
Well,
it.
and I think not even prepper, but I think like I do mission trips, and I think it's so cool. Like what few things we can get by with. So like if you're, you know, where was I? Like Guyana.
Mhm.
I mean, in a church basement with no power, what you can do to help somebody is pretty awesome. But we're never given that opportunity. I don't know that some people would call it an opportunity, but like you come back to America and I've got my office, which is like I have everything at my fingertips. Anything
Right.
I need, I've got electric hand pieces, you know, anything. But I don't need that for 1 second the whole time I'm in another country.
So are you in Guyana for like an Operation Smile type of thing, or
Medical missions outreach, actually.
Oh,
I'm a
nice.
on today.
nice shout out?
I do dental missions, and I started that in dental school. So later this year, we're going to Ivory Coast, Africa,
Nice.
which will be my 6th mission trip. But yeah, it's neat. I mean, I've done dentistry with like somebody laying on a church pew and me in a folding chair at the end as our dental
But
office.
isn't that awesome though?
It is awesome, and they're so appreciative. Like you come back and you know you got somebody complaining because you didn't let the topical numbing jelly work long enough, and
Mhm.
you're like, we didn't even have numbing jelly on 5-year-olds, and they laid there like they were
Like a
30
champ.
years old and could handle anything. And you just there's a side to it where you're like super appreciative, but then there's a side to it where you get really like, you gotta be kidding me.
Yes, we have our society has
We're
become
so spoiled.
soft.
We're so spoiled. So spoiled. But yeah, I enjoy that. And so I think that's part of like my prepper. I'm like, what is the least I could get by with? Like, I think I'll, if somebody's got an abscess, I can pull their tooth. That's how I'll get by.
Right.
Is I'll do dental tricks, essentially.
I think it's neat to almost, I don't want to say, well, I mean, when you go and do those trips, I've never done one, but almost taking it down to the basics, like how the doctors back a century ago were doing doing dentistry or doing work on patients.
Would have been barbers, but yeah.
Barbers? The barbers?
The barbers were also dentists.
What?
Yeah.
The guy that cut your hair would mess with your
You'd
teeth?
be like, this tooth's hurting.
That?
Yeah. Well, I mean, Paul Revere was like a ironsmith or something. Like I guess his like passion was working like with tools and stuff. And he is the one who started doing dentistry. And not started on dentistry, but that was his other thing. So like I can't remember off the top of my head, but the guy who was identified by Paul Revere's dental work, it was like a walrus tooth and silver partial or something he made, like by hand. He's like, yeah, that's my work. It was something during the war, and the guy had been killed, shot in the face, and they had a mass burial. And his son came back and was like, I don't believe that he died. Like, conspiracy theorists and stuff were saying, no, he didn't. And they exhumed this mass grave and were like, there he is. That's my work. So, yeah. That's also how Adolf Hitler got his conspiracies squashed. There's lots of conspiracies about him.
So one of my favorite conspiracies about him is that the remains is actually a female skull of his. That's not him. That he was out.
That was one of the conspiracies. So they said that it wasn't him that died, and they had a body that they put in his place, and that he had escaped to like some other country with a lot of the other leaderships. Well, it's not true. I mean, they like kept his remains like behind the red wall or whatever forever, and then some French scientists were like, prove it, and so they pulled him out, and he was identified by his teeth as well.
So this whole thing that I watched,
nasty teeth.
Did he really?
Yeah, like really bad period disease, and he had like a ton of.
It's from the meth.
He was
on a lot of uppers, I heard.
It wouldn't surprise me, but yeah. So I actually have an image in one of my presentations for UNC, another job, and like it's his bridge, I guess, on the front that had survived with the roots in it. I mean, it was just gnarly, and then he had like one of the first x-rays. I mean, it is old, but it's a full skull radiograph, and you can see it in there when he was alive. So it's so they squashed that one.
Well, damn, that whole thing. I was watching Hunting Hitler on whatever channel that was with Tim Kennedy, and they followed,
Yeah, no, he did.
Damn it. Well, I mean, I'm glad he's dead, but now I wasted all this time. But I mean, a lot of the German soldiers, especially the higher ups in the SS, did escape through U-boats, and they did go to to South America, and I didn't even know that because I didn't get that history lesson at Sexual High.
Yeah.
But a guy that I used to work with from Puerto Rico, his wife is from Brazil, and he said you can tell where the most of them landed because I can't remember if it was north or south, but there's a lot of blonde hair, blue eyed,
like population there.
Yeah,
yeah,
and their children.
Yeah,
and I was like, well, I'll be damned.
Which makes sense because coming from Brazil, you would think it would be like dark skin, dark hair, but there are a lot of Brazilians that have that beautiful like olive skin with the blonde hair and blue eyes.
If you were not a dentist, what would you be?
I have a whole list of things that I would be. It's literally just a matter that I don't have the time that I'm not already doing them. First, probably a forensic pathologist.
Okay.
Because I think they have the coolest job. Them or a forensic anthropologist. So a forensic pathologist is the one who actually does the autopsy. So as a medical examiner, I decide, does this person need an autopsy or was this natural? I have to determine how they died and whether or not it needs an autopsy.
And when you do that, do you go to like the scene in someone's
Yes.
house?
Wherever
Wherever
they
it
are.
is.
Nobody's allowed to move them until the medical examiner gets there and can do a scene assessment and everything. If they need an autopsy, then I organize their transport to our autopsy center, which is in Winston. Or if it's natural, like it's an elderly person in hospice or an
Right.
elderly person at home and they've got this long medical history and it's obvious that they just passed away, then I transport them to, or organize their transport. There's multiple vendors for that, but to our morgue that's in Mooresville. And then I meet them there and do a full body exam, toxicology,
Wow.
draw fluids. And
You do that.
I do that.
So you draw like from the, what is it, the iliac artery or wherever from
the femoral is ideal for blood.
Okay.
If you can't get it from the femoral, I get it from the subclavian. So
Yeah,
right in here.
right.
And then vitreous fluid from the eyeball, which took me a while to get over because I don't like eyeballs. And then depending on what is going on, I may have to draw
Even urine from the bladder and all
urine
that stuff?
from the bladder or pulmonary.
Get out.
Like if there's fluid in the lungs, they want it. So you got to send it to toxicology.
You're coming back for a part 2. I'm just saying.
I got so much. Yeah, I don't know where I find the time to do all this stuff, but yes. So, for instance, I would really like to actually have the knowledge and do the autopsies as a pathologist or the anthropologist. So they are bone people, so they are going to be the ones who are doing the grave recoveries and seeing, all right, this is X, Y, and Z bone, and is this human or animal, and things like that. They have a really cool job. But outside of like science, I would really like to be a personal shopper.
I'm so glad you came back with something normal because you were being like way too nerdy and smart. Like, and you're like personal shop, like for people or
Yes.
like
I
rich
almost-
people would hire you to go do their shopping.
Yes, like, you know,
Now we're getting
some
somewhere.
rich Mariah Carey mansion type
Yep.
person and say, you know, I don't really know what looks good on me. Will you just spend $10,000 and go buy me some clothes? I would be like on it. Or decorate their house. I like to decorate, so
Okay.
something like that.
Wow.
I could also be a pretty good wedding planner.
A wedding planner?
I like to plan. I'm a very
Detail oriented.
very detail oriented wedding planner, event planner, party planner, travel planner. Yeah. Yeah. My husband hates me.
I don't think that's true. I think knowing your husband just a little bit, I think he just takes a deep breath and goes, okay, honey.
Yeah. What time do I need to be there?
Yep.
Yeah.
Which is the best.
Yes, he is the best.
So where's your most favorite place to vacation?
That is a really hard question. I am a mountain girl at heart.
Really?
Yeah, Brandon and I are both very mountain people. So we've talked forever. We would love to have a house in like Banner Elk. I mean, just somewhere secluded with a great view.
We were just in Banner Elk a month ago.
I just love it up there. I mean, obviously Eli's middle name's Boone, so we are just up there. We like that up there. Brandon's not a big beach person. I like beach, but
I don't understand why he's not a big beach person.
I don't know.
His skin just seems to adapt
just
to the
soak
sun.
in the sun. Yeah. I'm not a big like North Carolina beach person. Like I want to go where it's scorching hot. Like I'm like Aruba or like we went to Antigua on our honeymoon. I would go back there in a heartbeat. So somewhere like that. But the best I think vacation we've been on was Ireland.
Oh, okay.
Yeah.
Nice.
You know, where it's cloudy and rainy.
Yeah, I was going to say, do they have mountains there? I don't know.
They do have mountains, but they have tons of Irish accents, which I love. And then Brandon fits right in.
Yes,
I mean, with the red hair
he's
and
home.
the green eyes and the white skin, he's just...
He has green eyes?
Mm-hmm.
Really?
Beautiful. Yeah.
Oh, listen at you.
They're like see-through green. They're so pretty. Yeah.
I'm going to have to awkwardly stare into his
You
eyes the next time I see
It won't be awkward at all. It won't be awkward at all. They're so pretty. Yeah.
Oh, good. It's also nice that you talk with him, like you talk about him like you still like him and love him. So that's also nice.
Well, I thought you were going to ask me if I was stranded on an island, what would I take with me? I just said
coming.
Brandon.
Really?
Yeah. I mean, I need help.
Is he the type of mate that can actually help in the scenario?
I think in that scenario.
Okay.
Yeah. Yeah, in that scenario, I think he'd be very helpful. He's not the handiest guy in the
I get it.
world,
Neither am I.
but I think if we were like forced to survive, we'd do fine.
Yeah.
Yeah.
Um,
Like, I don't want him to hang any pictures in the house.
Same. I think it's in the name. Kristen hangs all the pictures.
I have to. Like,
Yeah. Nope. Mm-mm.
I don't want him to touch anything in the house. But as far as like outdoors and survivals and guns and things like that, like I would want to be with him.
Yeah, I'll take care of that stuff. But like right now, we're putting together a basketball goal. She's really the chef, and I'm more of her sous chef right now.
Yeah.
Putting that together.
Well,
She's more engineer minded.
We just had a basketball put together, and we just hired our friend to do it.
Well, this is day 3.
Yeah, I will put a plug in there for Matthew Hicks, who is the handiest of all men, and he's one of our best friends.
Well, Matthew, I may have to call you here soon if this basketball goal isn't put together.
Yeah.
Who is your favorite musician or artist of all time?
Dang, that's hard. So I am a huge country fan.
Okay.
So Dolly would be like queen. I mean, I have to say it's an obligation to say her. But I also love Christian music, especially like the latest stuff that's come out.
Mhm.
So Kane would be one of my favorite bands. I'm going to see Brandon Lake this summer, which the Brandons, I mean, you gotta go see all the Brandons, but
Might as well.
yeah, phenomenal. Just kind of that kind of scratchy, like deep, kind of like Chris Stapleton type voice, but singing about Jesus, and it's like you can't get any better.
Interesting. I wouldn't have picked any of those for myself, or think that's what you would say.
What did you think I would say?
I don't know, but it wasn't that. I was
Yeah.
really, really hoping you were going to go down this Taylor Swift path.
Now, I do like some Taylor Swift, but I was never on the bandwagon.
Okay.
I now like her because Ella Rose likes her.
Right.
And she is not a bad role model compared to a lot of the non-Christian stuff that we can listen to.
Yeah, Sullivan's a huge Swiftie because of our neighbor, so I
Mhm.
purposely don't like her.
Mm-hmm.
Didn't like her really before, but definitely don't like her because Sullivan likes her.
Yeah.
So that annoys the crap out of her. So
It's so fun. Look what you made me do.
yeah. Well, Sullivan.
And then Eli says, "What did they make her do?"
Oh,
And I'm like, I don't want to talk about it.
yeah. Change the channel.
Yeah.
So Sullivan would listen to. We were probably terrible parents, but watch the videos or actually the music, and she would be doing the dances.
Oh,
You
yeah.
know,
Mhm.
and I'm like, why are
Yeah.
we doing this?
Well, that's probably a little better than Ella Rose's favorite song,
Which is
"Earl Had to Die." Yeah, she knows.
well.
She knows every word, and she may have gotten that from her mother.
I was going to say, didn't he get killed, put in a trunk, and
He did,
They
and dumped
took-
in a river.
yeah,
I mean, it's coming. She's got to do something in forensics. I've got to train her up right. But yeah, she's like, "What are black-eyed peas, Mom?" I'm like, "We're never eating those. They're disgusting."
really.
Yeah, I don't like them. But I make her think that they're poisoned because Earl died because he ate those black-eyed peas.
I
Yeah.
get it now.
Yeah.
Jeez, what is one hidden talent no one would ever expect that you have?
I don't know. I know what Brandon would say, but I don't wholeheartedly agree with him. Most people don't know that I sing,
Okay,
and he always says, "Oh, she's the best." I'm like,
so you're a singer. So you
I
sing.
like to sing. I
Okay.
do. I sing at church and in my car. I'm really good in the car.
Well, aren't we all? I am phenomenal.
I mean, it's
in the
just
car.
yeah. My mobile tabernacle is what Richard got last week.
All right. Last question is: you could have dinner with 2 people, dead or alive. Who are they?
Dinner with 2 people. Let's see. Jesus. It's got to be one of them,
Boy, I bet he's got some stories.
right? I mean, that'd be a long dinner.
It's gonna be a 7-courser.
I'd need him to like tell me how to do better. Like, let it be just a one-on-one. Go ahead, lay it on me.
I did a bunch of really bad things today. If I really
Yeah.
say I'm sorry tonight, it's cool.
Yeah.
Like, for real.
Can I still see you again?
Right.
I don't know. I mean, I guess Dolly would have to fall in that category as well.
Jesus and Dolly.
Jesus and Dolly.
Well, That is
That'd be a phenomenal dinner.
it wouldn't be boring.
Well, and I'd like to do it one-on-one so that Jesus doesn't hear what me and Dolly got to talk about.
He hears you anyway.
He does.
So you might as well belly up to the bar, Jesus.
Bring him on.
Come on in here. We're talking. So if anybody is looking for a new dentist, are you taking new patients?
We are. I cannot say anything without saying how amazing my staff is. And that's not even like that's not even
Not
like an
blowing smoke.
advertisement. These people are amazing. And so, like, even if people don't really care for me, they are worth seeing and being made comfortable. Like, nobody comes. They'll come and be scared to death. But by the time they leave, they're laughing and talking, and they've made a whole new friend. So, we are booked out.
Good.
Like, super far for cleanings, especially. So we always say, we are accepting patients. They can call and get on my schedule fairly quickly, but as far as cleanings go, they'd have to wait a little while.
Okay.
But it's kind of like every other practice. You book your next 6 months when you get your cleaning done, so everybody gets in that rotation.
Right.
But it's just getting that first one in. It's going to be about 6 months.
And how can folks find you?
Physically or
Like if they were looking to find your dentist office.
So
If they're dead, they are going to find you. You're going to find them.
somebody's gonna find me. Somebody's gonna call me and be like, "Can you come here?"
I feel like your phone rings a lot.
My phone rings a lot, just for multiple reasons. But so our website's Carolina Crossroads Dental Care. So our name is based on 77 and 40. Where Statesville is the crossroads of the Carolinas. So that's the easiest thing in the future. It's the easiest thing to remember. So it's Carolina Crossroads Dental Care.com. Super long, but easy to remember. And then you Google. I think I come up number 1 in dentists near me. And, like, there's a few, like, terms that you can type in. Invisalign near me. My name comes up pretty quickly.
Nice.
Yeah, so just search up Lindsay Spears.
Lindsay Spears.
I'm there.
Well, Dr. Indiana Jones, Lindsay Spears, thank you. I appreciate it.
You're so welcome. This wasn't near as bad as I thought it was going to be.
No. I mean, did you think it was bad? But, yeah, appreciate it. And you'll have to come back because I want to hear more stories. And we're just going to talk about death and all the fun stuff.
You let me know when you're looking for a downer, and I'll be here.
All right. We'll
I
hold you
got
to
plenty
it.
of stories.
Awesome. Thanks. We'll see you.
Thanks,
Thanks, everybody.